There was a time I was seeing a patient that was some time ago. She had been healed for many years, and that was when she was about to enter into her institution. She just finished a secondary school, and typically the parents thought she had a spiritual attack, and she had been taken from one prayer house to another prayer house, taking a lot of concussions. And recently she came to the hospital, and this was after 10 years. She came to the hospital. She was seen by the doctor, given some treatments, prescribed some medications, and within 4 to 6 months, she got well. All the symptoms stopped. So, what I realized then was that many patients and their caregivers, their family members, don't really understand what mental illness is. Because they usually come to the hospital after trying every other thing. What brought a lot of people to the hospital is the fact that they have tried all things, and I believe they deserve more than that. Growing up, I know that mental illness is not something people just talk about easily like that. Any discussion that has to do with the mental health is usually not discussed in the open. So when a member has an illness, everybody wants to cover it up, even the way people treat them in the community. Recently, I heard about a guy that was beaten to death without doing anything. I mean, some of the young men in the community beat him up until he died. Why? Because they used to see him as one who was mentally ill. Was it because of stigma? Do they even understand the pain the parents will be going through? That is the prejudice I'm talking about. That is how the stigma around mental illness has always been. And there's something about the mind of human being that I am very much interested in. The human mind is so critical. It is with the mind that we're able to carry out a lot of things that we carry out, and even who we eventually become. The mind of man is very critical, and I see a disconnect between what mental health, what psychiatric care is, and what people perceive, what our cultural beliefs are, even spirituality. We seem to believe that mental illness is different from faith. Some people believe that having a mental health challenge, it means the person has lacks faith, or the person is not strong enough, or the person is not praying enough, or the person has committed a particular sin. That is a disconnect I've seen, but I believe that even mental illness must be culturally grounded, because the way mental illness appear, the way it is, the characteristics that we see here in Africa, in Nigeria, is different from what people perceive it to be in the Western world. The manifestations of mental illness that we see are usually culturally grounded. And I also believe that faith should not be an obstacle to receiving care. Faith should be an anchor. Faith should help you go through the process of recovery. Faith and psychiatric care can work together. I believe that families matter. A lot of people, when they are down with illness, don't want to involve their family members. They want to hide it. And it is still because of stigma. They don't want anybody to know. They don't want cousins, aunts, uncles to know. I'm not saying you should tell everybody about it, but you should not be ashamed of it. This shame is killing a lot of people, making people to suffer in silence. And so families matter. Those are the people that support the person that is going through mental illness. Healing cannot occur in isolation. It occurs in community. When there is support, people heal better and faster. Access to care also matter. People should be able to access psychiatric care without hindrance, without hindrance of fund, of location, of and maybe even presence of a specialist. And so when I talk about whole mind, whole life, this is what I believe people should experience. This is what I believe about the people I see every day and every time. For me, I have whole mind telepsychiatry, which is not just another means to see people who need care, but it's to give access to people without having to move from one place to another. You can access psychiatric care from the comfort of your home, so people can access care wherever they are. And also, I have the WholeLine. WholeLine is for those who are in distress and they need somebody to speak with at the moment, like urgent care. And it's also for people that may not be able to afford to pay, but there are trained people that can respond to such people and to direct them and guide them into the appropriate care that is fitted for them. And I also have family support system. This is for family members, caregivers, siblings, people that are helping those who are going through this mental illness. So when you are supporting a loved one or a friend or a colleague or your parents or you are the children, this stability support program is for you, is for your own care. How to navigate what this person is going through, what to do, and how to help them stay through the process of recovery, and what you can also do to enjoy mental health stability. So, this is what I have for you. This YouTube channel is for everyone, whether you just want to understand what mental health is, understand some of these conditions, or you are supporting a loved ones, or you are just interested in how faith and culture relate with psychiatric care, this is for you. This is for you. Or even if you are the one who is going through this mental health challenge, you're going to learn a lot, and you're also going to learn how to remain stable so that you can walk along with your people that are taking care of you, so you can have a good and a quicker recovery, and and for you to remain stable over a long period of time. And not just that, and you will be able to achieve your purpose on earth and become who you are meant to be. So this channel is for everyone, and if this resonates with you, please like, make your comment, ask your question, subscribe, and if you need to talk to a doctor, the link to reach out is there on the description. So try and make use of that, and see you the next time. Thank you.